everyone. Welcome to the webinar. My name is Jordan Stark and I'm the brand specialist for CFC. I want to thank you all for joining today, and I would also like to introduce you to our founder and CEO, Leia Swanberg. Leia is with us today and she'll be leading the webinar on selecting a surrogate. She has some really great helpful information for you. We're just waiting for a few more attendees to join us. So before Leah gets started, I would just like to tell everyone that we are recording this webinar today, and everyone who is registered will be sent a direct link to the video recording by email. And we'll also be posting this webinar on our website, our YouTube, and our Facebook pages. We'll be taking questions all throughout the duration of the webinar, and Leah will be answering everyone live at the end during a Q&A session. So we ask that if you do have any questions, to please use the questions tab or the chat tab over on the side to do it. And yeah, feel free to ask them anytime. All right, looks like everyone is here, so I'll pass you over to Leah.
Hi everyone, it's great to chat with you. I actually just completed another webinar with surrogates or potential surrogates, explaining to them the process of signing up and becoming a surrogate, which myself, having been a surrogate, is really such a passion of mine. And so to ensure that women that are signing up to participate really understand the process is so important. And as well for, sorry, I feel very close to this camera. I'm going to try to adjust it. I don't know if that will work. Okay, feel much better now. And so, you know, again, for intended parents, it's the same. I want to make sure that as you move forward with this process, that you really understand what it is that, sorry, my camera's driving me crazy. Let me just, okay, there we go. That you really understand who surrogates are, you know, how they are coming to our program, what criteria we suggest looking for when selecting a surrogate, and as well based on where you live in the world or where your surrogate lives within Canada makes a huge difference. And so we want to make sure you have all the information going forward that is necessary to make the best decision for you and your future family. So today's webinar is on how to select a surrogate. So prior to selecting a surrogate, I suggest to speak to a lawyer. If you're a Canadian, speak to a lawyer anywhere in Canada because it is federal legislation. And so you can talk to a lawyer in the province in which you live or outside of the province in which you live, and they'll be able to give you advice. And you know why that matters is for this reason. If you are not going to be genetically connected to your child, so if you are taking over embryos from, you know, previous people who donated them to the clinic and who are then going to pass them on to you, you aren't able to have a surrogate in Alberta, for example. If you are a single person, again using, you know, donated gamete, you know, you may not be able to use a surrogate in another province. And so really getting that information, we have it available on our website, fertilityconsultants.ca. There's a breakdown of each province on our blog. But that often changes as, you know, Canada gets more with the times and with the program in terms of, you know, who is a parent as defined by vital statistics and the government. And so it is really important. And if you're from outside of Canada and, you know, it may matter. It may matter that you become a parent through a court application or a declaration of parentage. And so it's important that you speak to a lawyer first so that you really know not only what you're looking for in terms of the social contact and relationship you'll have with your surrogate, but that you're also aware of the legal requirements for you to have a surrogate, whether you live in Germany and require a single surrogate, or, you know, as I said earlier, whether there's no genetic connection, and we just know that Alberta isn't a spot for you to pursue surrogacy. So legal first. Second, as you begin to look at profiles or as you begin to search online for a surrogate, if you're listening to this webinar, but you're going to be going the independent route to build your family and not work with an agency, it's really important to look at a few different, sorry, I have this tickle. It's really important to look at a few important pieces as you're reviewing a surrogate's profile or as you're speaking to a surrogate online. And, you know, the first one would be, and I think the most important one would be her termination values. Does she share the same immovable value? And when I talk about that, intended parents often ask, you know, well, of course we would want to terminate if there's a medical abnormality. Then it is vital you find a surrogate who shares that same value, that on her profile or her form that she sends you if you're looking online independently, she has clearly stated that she would terminate for medical abnormality. And often you'll see on a surrogate's profile, I won't terminate for this, but I'll terminate for that, and really clarifying what that is. And so for many surrogates I talk to, they say, I won't terminate for Down syndrome. My cousin has Down syndrome, lived a wonderful life, but I would terminate for everything else. Or I wouldn't terminate for a clubfoot or a congenital deformity, but I would terminate for everything else. Really making sure that you know what that is before agreeing to move forward with her. It will be outlined in the contract, everyone's roles and responsibilities around terminating a pregnancy, but it is important that you share that value. And it's the first value that I suggest ensuring you share. Second, what is her timeline? Is she interested in getting started right away? And if so, do you have embryos right away? Or are you waiting on an egg donor who has told you in 6 months she can participate? You want to make sure that you are respecting your surrogate's timeline and that she's a fit for yours. So if you do have embryos and you're ready to transfer tomorrow, I will tell you this, even with embryos, from the time of introduction to a surrogate to the time of embryo transfer, 9 times out of 10 is 6 months. It may be 5, it may be 4 months, 3 weeks. Generally speaking, plan for 6 months. So as you're looking at surrogate profiles and it says, I'm ready to go in September, that's really the earliest she can go. Whether or not that's when she wants to go or not, just keep in mind 6 months really is the approximate time frame. And what would change that? So she may say, I'm ready to transfer in May, you know, so dig into that. Look at her profile. When was her last birth? Oh, she delivered in February. May isn't possible. You know, that's in 3 months. We need to have, you know, regular menstrual periods. We need to ensure she's no longer breastfeeding or pumping if it was a surrogate delivery. We need to have your fertility clinic review her birth records often, and then as well have her come in and have some medical testing to ensure she is in fact ready to proceed, because we're not sure until the doctor has reviewed that information. And so, you know, leaving some time between pregnancies is always a great idea. So, you know, oftentimes people will say to us, well, you told us she couldn't transfer for 8 months, but when we spoke to her, she may not appreciate the fact that the clinic is going to require her to wait for her safety and the safety of the pregnancy and health of your baby. So please, please keep that in mind in terms of timeline. Something else that's really important as you're reviewing a surrogate's profile or speaking to someone online is, what does bed rest look like for her? What do her expenses look like? Does she have 4 small children that would require full-time childcare should she be in bed due to a physician-ordered medical complication affecting the pregnancy? So what that means is, you know, many pregnancies go very smoothly and bed rest isn't required. However, 20% of pregnancies across the board with IVF require bed rest. And so we want to make sure that prior to you committing to a surrogate, that you understand if she is a nurse, her bed rest cost could be $1,000 per week times 20 weeks. That's a lot of money. That's a great deal of an expense. And, you know, this is your money, not ours, and your journey, not ours, but we want you to be aware. So as you review a surrogate's profile, it will break down for you what her bed rest cost is, what additional childcare will look like for her, what having someone come in to the house would look like, or getting her kids to school. There are a lot of moving parts when it comes to bed rest, and we want to ensure that you as intended parents are empowered to make that decision, that you understand what that decision even looks like. Because oftentimes people will select a surrogate because she's close to the clinic. There are clinics in Toronto, they want to pick someone close to the clinic. She has 4 kids and she's a nurse. And they pick her over the surrogate in Vancouver with 1 child who's a stay-at-home mom. While this Toronto surrogate maybe sounds better because she's there where she's going to get pregnant, but when we further, you know, sort of flesh that out, yes, to get pregnant may be less expensive, but to maintain a pregnancy, should bed rest occur, the cost may be substantially higher. So it's so important to look at that and to look at what those costs would be and to look at what her lifestyle and situation is, because each surrogate is a very individual person, and it is one part of the contract that cannot be capped based on your budget. It really is what it is. And, you know, 20% of surrogates, 20% of IVF pregnancies do have bed rest as a part of that. And bed rest, we suggest, is 10 days or more off work or in bed. Something else we suggest to really look at is communication. What type of relationship is the surrogate looking for? She's going to tell you. It's going to be clear. She would like very close contact. She'd like to be your best friend. She'd like to be your child's aunt. Or she's busy and she'd like to chat once a week. Allowing the surrogate to set that pace is really important. But prior to that, ensuring really being clear on that first introductory Skype call with the surrogate. Hey, Jenny, I noticed you said you wanted like daily contact. Here's what we can do. Here's what we're up for. You know, we are unfortunately very busy and we want to talk to you a lot, but every day might be tough. But we could talk to you every second day. Because making sure that as you move through the journey, you've set clear boundaries around the communication that you're up for, and that you have been clear with your case manager as well, so that they really know as they're talking to surrogates about you what it is you're looking for. And as well, post-birth, are you looking for a relationship with someone that goes the distance, or are you looking for the relationship to change significantly after the birth of your child? And it's very personal. I know for myself, having been a surrogate, I had put on my profile that I didn't really want any communication after. I didn't need that. And fast forward 15 years, last year I attended my first surrogate child's bar mitzvah, and it was amazing. I'm like extended family. We talk maybe a couple times a year because we're really busy and a lot of time has passed. But relationships develop organically. And so I think not putting a lot of pressure on yourself and saying to a surrogate, if she has expectations that you're not sure you can meet, thanks, Jenny, for sharing with me what you need. I really hope that our relationship develops to that point. I'm super new to this and I have no idea where this is going to go, but I'm so excited to meet you, connect with you, and share this with you. Because you don't want to let people down, and you really want to, live this journey authentically based on who you are. And if you are very busy and unsure of the time that you'll have to connect with a surrogate, to let her know. I really want to be a huge part of this with you, and I want to share this with you. So to really not over-promise, but to definitely over-deliver. Another important piece to look at is birth preferences. Where is your surrogate planning to deliver this baby? What does that look like? Is that something that terrifies you? Is that something that you're totally cool with? About 80% of surrogates use midwife practitioners. So in Canada, in most provinces, midwives are governed by a provincial body, and they are able to deliver babies either at home, in a birth center, or in a hospital, and they are able to provide prenatal care in low-risk pregnancies. So what is a low-risk pregnancy? It's a pregnancy in which there is low risk. So IVF pregnancies can absolutely be low risk. However, if any complications arise, like I spoke about earlier in terms of bed rest, etc., it goes from low risk to medium risk or high risk, and a midwife will unfortunately, or fortunately, release the care to either a general practitioner or an obstetrician. And so it's important to know, as you're looking at surrogate profiles, am I comfortable with a midwife? Is that something I know a lot about? Should I be asking my caseworker about that? Or, is it just a no? And I've taken enough risks. I'm wanting a surrogate who's only willing to work with an obstetrician. I can tell you, whatever she puts on the piece of paper that you're reading, the profile, that's it. I mean, there's no sort of changing that. So just as we would never expect you to change your values to suit hers, we would never expect her to change hers to suit you. So definitely have a look at that. If you have questions about what midwifery care looks like in terms of pregnancy, I can tell you in Canada it's very similar. They follow the same schedule as an obstetrician in terms of testing, in terms of ultrasounds, in terms of referral to other outside providers should a pregnancy complication arise. And so it really is a very safe, measured approach, but one that you need to be comfortable with. So definitely, I'm available, your case specialist available to talk you through that. But again, something that you will see on a profile of a surrogate. We talked about location of a surrogate. And again, that goes back to the jurisdiction in which you live. And then as well, the right surrogate will show up and location won't matter. I can assure you, many of you have said to me, I'm only looking for a surrogate here because I have family or friends or I live here. But when you see that correct profile where you just go, wow, yeah, you know what? I know I said this, but this surrogate is amazing. So when we send you someone, please know that we are sending them to you because we really, really know that this person would be an amazing fit for you. The next thing that I suggest to look out for is, if we're sending you a profile, it's because your clinic has reviewed it and said that this is someone they would work with. So often people will have questions about, sorry, my hair is driving me crazy today. Often people will have questions about medication that a surrogate may be using, whether it's an antidepressant. You may have questions about previous pregnancy, health history. You may have pregnancy. You may come to this journey with your own trauma around birth, around pregnancy, around the delivery of a child that may have passed away or may have been born compromised. And so it's really important that your case manager know that. And it's really important that you know this. Any profile you receive, your doctor has reviewed, your fertility clinic has looked at and said, yeah, this is a good candidate. So when you see a young woman on antidepressants, I will tell you this, it is a Canadian epidemic. 1 in 4 women of childbearing age is on an antidepressant or prescribed an antidepressant in Canada. And so what's really important to know about that is if it's listed there as something she's currently taking that is not a pregnancy safe medication, she'll be required to wean off of that and onto a pregnancy safe medication. If she many surrogates are on antidepressants but are willing to go off, so they'll be weaning off of that medication. But something to check with your case manager on. We absolutely have a plan for every woman entering our program around that, because it's just so prevalent. And the same with any other health things. We have spoken to your clinic and we have a plan around them. So if your surrogate has had 2 C-sections and in her profile it indicates that she'd like to have a vaginal delivery, it's really important that the fertility clinic assess that. We are not medical professionals at CFC, nor are there medical professionals at any agency. And so, we will send you a profile by which your clinic has approved her, but there are definitely conversations that will have to happen when the surrogate goes for screening. And so we want to make sure that any surrogate you match with has been previously, at least on paper, by their profile and medical records, approved by your clinic. And then from there, when they screen her in person, they will as well have lots of questions for her to make sure that you're all in the best place to move forward with your pregnancy. I often have said, and I actually haven't said it for a while, but Mary Poppins is not floating down from the sky with an umbrella to place a magical baby in your arms. And I say that because I really want people to appreciate that women that come to our program are coming to our program, yes, while it's for you and to help you become parents, often it is they are looking to become a part of something that is absolutely unexplainably amazing. They want to participate in something in which they will change the world, they will change your world. But with that being said, they have life going on. They are busy moms with busy lives, often school-age children or babies or a spouse in the military who's away. They have a lot going on. And so for us to really manage your expectations, your case manager to manage your expectations is key. When your surrogate's available to chat on the phone, that's when you chat on the phone. When your surrogate is available and inviting you over to her home or to meet for lunch, that's when you go for lunch, or that's when you go to her home. It's really important. And when we look at that, it's that this surrogate is doing this amazing thing, and we really want you to value her. But we are not in a commercial system. She is not being paid for her time. She's being reimbursed for her expenses. And so it's really important that there is no financial motivation. And if there's no financial motivation, what is it? I know for myself, it was this idea of helping my neighbor, who then ended up not going forward with surrogacy. So I found information about surrogacy through an agency and became a surrogate. And it was amazing. But I will tell you that during my journeys, my husband had been posted overseas for 6 months. My kids got sick. My grandmother passed away. I mean, life happens. And so when I talk about Mary Poppins floating down from the sky, it's really to give context to the fact that, these women who participate as surrogates are amazing people, but they are real people dealing with real lives. And so understanding that from the outset, can you manage that risk? Absolutely not. Do I wish I could manage that risk for you? Absolutely. But sometimes life happens, even when women are giving this most precious gift of surrogacy. And so to really, really evaluate how you're able to roll with those punches. Not every embryo transfer works the first time. Can I predict who it's going to work in the first time and not? No. But what I can say is, finding women that are committed to this process is really the key. And so as you begin speaking to a surrogate, how does it feel? Do you feel like, wow, this woman would do anything? You know, wow, could I imagine spending the next year to 18 months with this person? Because if you can, then she's the right fit. If you're uneasy the entire time, listen, there's a bit of unease at the beginning of like, okay, I'm a little nervous, but checking in with, you know, if you're working with CFC, you can check in with me, checking in with whoever did your introduction over Skype, checking in with your case manager about your nervousness, so that we can either reassure you or confirm that, yeah, you know what, it really should feel a little more comfortable than it does, is quite important as you move through this process. So that is really sort of, those are my suggestions about how to select a surrogate. Jordan, are there any questions that have come in?
Yeah, we have one question here. An IP is wanting to know, do you think that the international situation on the coronavirus emergency could lengthen the time to find a surrogate?
We're not finding it lengthening the time to find a surrogate. What we are finding is that depending on where your fertility clinic is, you know, it may lengthen the time from match to screening. We know that California has, or had last week, declared a state of emergency, and we're finding that at this point, we're just putting screenings off of surrogates that are traveling to clinics in California. But otherwise, we're finding that, you know, the number of surrogates we're taking is, you know, is similar to weeks previous to the coronavirus.
Okay, great. That's all of the questions we have right now.
Okay. Thank you everyone so much for joining us. I know I was very vague on today's webinar. And I think that's because everyone really does come to this process with their own expectations, their own criteria of what they're looking for in a surrogate. And so if you have any follow-up questions or you want to jump on a call, I can usually do so within 24 hours. In my email signature, there's a book a call link, or you can just shoot me an email or a text, and we can get on the phone and sort of talk through any questions that you have about the process. And I look so forward to connecting with you through our next webinar. We have a series of, I think, 12 more weeks, so there'll be many webinars to come, and yeah, I look forward to talking to you then.
Oh, Leah, we have one more question that just came in, if you still have time. They would like to know, how long does a surrogacy typically take in total?
Sure, absolutely. So if you are even thinking about surrogacy, contact us. Let me get you into a fertility clinic. Let me get you to talk to a lawyer. General wait time from the time that you fill out your application form is 6 months to match, 6 months to transfer, 9 months to have a baby. So when we look at that, we look at about 21 months. If everything goes perfectly, which, you know, we hope it does. But, you know, if you plan for 2 years from the time that you connect with us, the time you have a baby, I think you're right on track there for timing.
Great, wonderful. That's everything. Oh, one more. All right. How important is it to make a good introduction video to present to the surrogate?
It's everything. I mean, I don't know if your case manager has sent you sort of videos to have a look at, but I mean, 3 years ago, we didn't have videos, and we would literally call a surrogate and go, great news, these people love you. And then all of a sudden, other agencies started doing videos. So I thought, okay, we're going to do videos. And there's always like those intended parents that have like the most amazing video, and surrogates love that. So definitely doing a video is important. It can be as simple as, you know, hey, we're so-and-so and so-and-so, we can't wait to be parents, have a look at our dog, you know, this child's going to be loved, grandparents, da, 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 da. You know, a 2-minute video, anything that really just shows who you are. And when we have surrogates select intended parents, and I asked them, like, why did you pick them? Oh, they had the same dog as me. Oh, the 2 guys were wearing bow ties and it was really cute. They love to garden. I love to garden. You know, it's very random. We don't really know what it is. You know, and unfortunately for every one surrogate in Canada, you know, there are 10 to 20 sets of intended parents. So unfortunately, it has become, I hate to use the word competitive, but it has. But what's more important for you to know is every surrogate doesn't have to like your video, one does, because there is a surrogate out there for everyone. And it really is as random as I like to garden. They had the same dog. She had breast cancer. My sister had breast cancer. They were gay. My brother's gay. It really is that random. So I would definitely encourage you to get a video together, because it really is a way for people to see who you truly are and make it easier for them to decide to partner with you.
Wonderful. That's all for today.
Excellent. Thank you, everyone, and we'll see you on our next webinar.